Good morning, everyone. We are coming to you with a very special episode right now with Aliza Tropper. We've been spending a lot of time talking about the mental health and the emotions behind all kinds of struggle to have a baby, infertility, pregnancy loss, miscarriage, stillbirth, adoption, surrogacy, this big struggle to build your family and how it really can wreak havoc on your mental health. And so we're using this time right now to, hello. We're using this time right now. I'm going to grab her. Yes, I'm going to grab her right now. We're using this time right now to have a discussion with Aliza Tropper, who is really a wonderful therapist who her personal work. And I think, yes, we talk about so many of these pieces here as well. Here she is.
Hello.
And here, let me
Okay, I made it.
adjust. You made it. You made it. We all made it.
Okay,
We're making it
awesome.
work. We're
Hold
making it
on.
work. Are you there? Are
I'm
you
here.
good?
Yeah. Do
I,
you hear me?
I do.
Okay.
I do.
I'm
Oh,
just making sure that, okay, this lighting is okay. Okay.
you're perfect. Okay. So, let's just launch right into this.
Yeah.
So, Aliza, tell people, first of all, introduce yourself to people. Tell people, like, what is the meat, the bread and butters of the kind of work that you do, generally speaking? Like, what kinds of people do you see? And then talk about the kinds of things that you see and that you love to deal with in terms of the fertility realm.
Okay, sure. It's always a hard question to answer. What do? It's like summing up. I would say I work a lot with adults and adolescents, people who are struggling with anxiety, depression, or just feeling stuck in some way in their life. Um, and we run DBT groups. I also, work with trauma, EMDR, CBT with anxiety, and really just people who are stuck in some way and are feeling either they're in a situation where they can't seem to get out of, whether it's relationships, or dating, um, this different transitions in people's lives and the anxieties that come along with that. I would say. Um,
Amazing, amazing. And now talk to us specifically about the kinds of people and the situations that you see specifically in the fertility realm. And then we're going to get into some more of like the details. But what kinds of things are you seeing? Like, obviously, we know that there, like, people who are struggling to have a child are at increased incidences. There are increased likelihoods of dealing with anxiety, depression, or other mental health challenges. What are you seeing? Who are the people that are coming to you?
so I think it really is like such a vast in terms of where people are struggling with. It always just comes up in the therapy room. I mean, having a child and whether it's you feel like you can't at this point, I think there's so many different aspects of grieving, of struggling with infertility, from miscarriages to going through IVF, through wishing that you were married and not being able to do that, or just feeling mentally that you're not in the space where you could have a child right now. And that also brings up a lot of grief. So there's so many different parts that I think come up so much in the work that I do, which is why I just want to give a space for people to validate their experience and, really just talk about that and understand that everything that you are experiencing, every single emotion is valid and makes so much sense. Like, people don't realize, people think they're going crazy. Why is it that I'm feeling this way? Why is it that I'm feeling angry? It's like they feel guilt and then they feel guilty about feeling angry. And it's like, of course you're going to feel angry. Anger means that I am not a goal is being blocked. That there's a block in a goal that I'm trying to get, or that things are turning out different than I expected. There's nothing wrong with feeling anger. Guilt, this belief that they're doing something wrong. Me personally, I've struggled. Also my personal life, I had some recurrent miscarriages, and I remember thinking like, what am I doing something wrong? Maybe I'm not eating right. And then getting people, they care about you, so they make comments about like, oh, maybe you're exercising too much, or maybe you're not eating enough. I'm like, do you know what I eat? So I think that there's this natural guilt that people feel, and I see that over and over again. Like, maybe I've done something wrong, and no, guilt means that you've done something wrong. Let's explore that. What do you mean? why do you think you've done something wrong? And often it's like, no, I'm doing everything I can. This is out of my control. So there's all the shame. You know, shame is this idea that I've done something so terrible that I am going to be rejected from my community. And if it's so normal to feel shame, at the same time, though, is shame justified? Like, are you really going to be rejected? I mean, there is on a lower level in our community, so much of our community is about having children, going to school and events, and so much is about that. So you can say in a certain sense you're in some way being rejected, but not really the shame that people are feeling. So we want to validate that. It makes so much sense that you're feeling all these emotions. And at the same time, let's also check, like, is this really true? Like, allowing yourself to have these emotions and also not judge them. And also, like, let's check, is this really true? Are you really going to be ostracized from your community? Are you really doing something wrong? So I think, you know, there's so much research that's shown that people who are going through infertility are experiencing the same feelings as if they've had a diagnosis from cancer.
Really?
And yeah, there's I've seen that people experience the same, you know, emotional experience, which just shows that this is such a hard thing on so many levels, you know. And it's really considered, there's this, like, infertility is this ongoing loss that someone is going through, and also it's like a profound loss and also an ongoing crisis that's happening. And, you know, we could talk about that a little bit later, like, how do we deal with grief and crisis? But I would just want to really just let people know that every emotion that you're feeling is normal and valid. And I think that often can give so much relief with people. It's like they think they're going crazy. They think that they're a terrible person for feeling envious, for feeling angry at a family member or their doctor or their friend that shared some news with them. And it's like, no, of course it makes sense. Like, you want something that you can't have right now. You know, we don't want to act on the anger. That never helps. And it just makes us more bitter and full of resentment. But I think that is often gives such a load off people's shoulders, even just a little bit of knowing that, okay, like, I'm not crazy. It's normal to feel this, because that's what grief's all about. Grief is, we experience all these emotions, and it's really, in order to get through the grief, we need to allow ourselves to feel it. You know, but not, you know, yeah, you have any?
Yeah. No, I want to talk more about this, but I want to get to grief in a little
Yeah.
bit. Let's sort of focus on the emotions. I'd love to focus more on the emotions of infertility first. Can you say more about what you mean about the like that infertility is similar to the emotions of cancer? I mean, the way I'm thinking about it in my head is that, you know, cancer is this diagnosis that once you hear about it, often people feel or fear for their lives. Like, they don't know if they're going to live. Like, that's like, cancer has this like terrible like connotation from that standpoint, but which infertility does not. Like, you don't think when you get a diagnosis
Right.
for infertility, you don't think, God forbid, that like, are you going to survive till next year? But the pieces that seem to me that are similar are the fact that it's a chronic
Yeah.
diagnosis, in the sense that, like, it's not like you get a diagnosis of strep throat and you take antibiotics and it goes away in a few days. Like, it's something that is constantly a part of your life that you have to figure out how to manage, and like how you're gonna live with it, who you're gonna share it with, who you're not. Like, is that what you mean by the fact that it's similar? Like, what
Yeah.
does the
So I
research
meant,
show?
maybe I wasn't so specific, but I meant the stress levels that people experience with a diagnosis of cancer is there's this, it's the same level. That's what some of the research has. I don't know if it's research, but I've definitely heard it more than once before. It's, I think, the uncertainty of not knowing, of living in chronic stress, a crisis. You know, a crisis is something that's short term in a sense, right? Like, it's not going to last forever, meaning, and that's obviously, how long does that mean? We don't know, right? But
Right.
the idea of a crisis is something that we can't solve right now, but we need to go on to living our life. So in that similar way of you know, that's the similar way I would say it's this ongoing crisis. It's a lot of uncertainty, and the stress levels just happen to be similar in people that are going through both. That's what I would say.
I Yeah, it makes so much sense. And also, I think, like, this emotional roller coaster of like, hopes and disappointments, and hopes and disappointments, like the idea that like maybe this treatment is going to work, but then maybe it doesn't, or like maybe I'm going to get pregnant this cycle, but maybe I'm not. Like is your period late? Then you're like, oh no, it's only late, like not because you're pregnant. Like this constant like up and down. And I think that it sounds like that's similar as
Yeah.
well.
The Yeah, definitely. I think so too. This anxiety of the uncertainty of not knowing and waiting, like you're living on the edge. You're restless. You're waiting for your next appointment, right? Thinking about whether it's fertility treatments and waiting for your next cycle, and with cancer as well, waiting for your next appointment. It's just you're living so much in uncertainty, and it's like this idea of how do we get through hard moments in our lives when we cannot change them. So often, I think that's something so important in any situation that we're going in life, because so much about life is living in uncertainty. And with infertility, it is so much of living in a crisis and not knowing it. It's how do you go about your day? So I think what's really important is, it's not about making our life, there's this idea of distress tolerance, right? Like, or certain skills, which it's just a way of dealing with life when we are in crisis. It's how do we get through hard moments without making it worse? So sometimes people think, oh, that means like I'm supposed to feel good. This is not necessarily about, you might have moments where you feel good, right? Some days are better than others, but it's the idea of how do we improve the moment that it's more tolerable. So things like self-soothing, like can make the moments more tolerable.
What
If we talk about,
does that mean? What does self-soothing mean?
so self-soothing could be anything from, I am going to sit with my lunch for 5 minutes. I'm going to really take it in. Obviously, to bigger things like taking a bath, but what are the things that you're doing with your five senses? Because that fills our stimuli. When we do things with our five senses, that fills us up, right? Like there's this real change that happens in our bodies when we use our five senses and we fill our minds and bodies and sensations up with that. That can really, really help us make the moments more tolerable. So yeah, drinking a cup of tea, whatever it is for you, distraction. Now this is the thing where people often get confused with that as well. It's like, oh, I should be distracting myself all day. No, for distracting yourself all day, we're not living, but it's about living in the present moment. You go to work, trying to drop into it a little bit. It could be natural distraction of one thing at a time. Mini vacations is how, which doesn't mean, yeah, maybe you want to go to the beach for the day, or you decide to turn off your phone for a day, or you go into, you say, you know what, today, I'm going to take a day off and I'm going to stay in my bed for one day. If you stay for days, then that can lead to depression. But it could be mini break, 5 minutes in your car, leave your office, go outside. So it's these things that will make these moments tolerable. Again, I'm not saying that it's a hard situation you're going to be in, but I think when we understand that I can do things that can improve the moment just a little bit to make the situation more tolerable, that's when it can actually be, there's going to be so much pain, but suffering is something that we add on to pain. And I think the suffering will come when we don't, when we add on to the pain.
I love the way you just said that, like that suffering is something that we add on to pain, that you can't change the pain. I love that. I love that. And it's so true in so many different areas. Like I wonder though also, like what about like when people are constantly feeling like this idea that you were talking about in the beginning, right? The idea that like I'm not going to be accepted by my community, or I'm not going to be like I'm going to be ostracized by my community, or my whole family, like everybody else has all these kids and I don't, or my friend group. Like what do you how do you suggest that people deal with that? Because it's very real,
It
right?
really
It's
is.
very real. It's very valid. Like that's the first thing. Like I love what you said in the beginning about like just validating it. Like it is the case that most people are not like you. It is the case that you are different. Yes, 1,000%. But like we can't change the pain.
Right.
So how do you manage that piece of it?
Yeah, I think it's really, really difficult. I think it's really going in and leaning into yourself and being in touch with your own feelings of what you can handle. It's okay to say no to that event. It's okay to not, show up for show, or go to that. You have to listen to yourself. Like, what is it that I need now? And I think that that's how we can deal with the shame. It's, you know, it's really tuning into, sometimes our people's bandwidth is bigger and they're able to deal with more. They're feeling a little bit better that day. But I think it's really about listening to yourself and not feeling bad about it. Like, okay, you know what? I don't think I can attend this thing. It's going to be too much for me. Um, so I think, you know, I think a lot is like leaning into yourself and asking yourself, like, can I handle this right now? And being okay with it. Don't, so often what we do, some people do is they turn off their feelings. They're like, no, I'm not listening to this. And I'm just going to go and I'm going to push through. And sometimes it's okay to do that. You know, if it's your sister's wedding, you're going to have to do that, right? Like, but then it's like, how much am I doing this? You know, sadness, the purpose is, what's the point of sadness? Is we want to withdraw, right? Like, and there's a need for that. When we are sad, it is important that we withdraw a little bit and we go into our little cocoon to kind of regather ourselves and think about, okay, now how am I going to live my life with this thing? And need space. That's okay. So I think we want to listen to that. And at the same time, obviously, if you're withdrawing all the time, that's going to really, really lead to depression and, you know, and suffering. So it's really a balance of listening to yourself, not shutting off your emotions, you know, and at the same time, like not doing anything excessive, because then you're really, really, I think you're going to suffer more, you know, if you always withdraw. Then you're going to feel lonely, which is, you know, part of infertility is a big part of it is this big feeling of isolation and loss of control, which yeah, naturally people are going to feel isolated. They're going to feel shame. And also, you know, to help manage that, even though you've done nothing wrong, but just the way the community is can make people feel that way, is let me check into myself. Am I up to go into this? Can I handle this right now? Is it okay to set a boundary and be like, sorry, we're not going to be able to come for the holidays, or I'm not going to be able to make it tonight. So sorry. Like, it's okay to set a boundary. So I think that's also really important.
And yet I think like I love what you said also just about like, yes, like you can set that boundary, but there are some things that you need to show up to.
Yeah.
But you don't necessarily need to show up to all of it. Or like you can take the pieces, like, yes, if it's your sister's wedding, like, yes, you have to show up to the actual wedding itself. Does that mean you need to show up to the all the things prior to that? Does it mean that you have to show up to all of the things after that? Like, no, but you have to show up to the wedding, right? So I think like choosing, I always found for me, like if I had this like big event, like I would choose the pieces that I knew that were mandatory, and then like everything else I was like, yeah, no, I'm like not doing that. Totally not doing that.
I like what you said about the parts. Like, yeah, like you can go in to say Mazel Tov if someone had a baby and it's your close friend. Go in, you don't have to linger around for the whole full thing, but go in and say Mazel Tov. You know, so I think and if you can't handle that, okay, but I think that will end up hurting the relationship. So you might want to push yourself, distract yourself while you're there, and then when you leave, go cry. But I think, yeah, I love that piece of like, even within, you know, just choosing.
Absolutely. I think like it's what we try to tell people to do, like choose the pieces that are manageable. But yet also, I think like, you know, the reality is that distractions and like distractions and also just like taking the time for yourself don't necessarily, like, it doesn't fix the problem, right? Like
No.
it doesn't, like, can you speak more about that? Because I think like I hear a lot from people that they want to use work as the distraction. Like work is fine, like work has nothing to do with like, you know, their infertility or their loss. We're going to get to grief in a second, but like they want to use work as a distraction, but then like they come home and it's still all there. So people like tend to push their emotions away and they think that it's going to make them better. Or even the like, I'm going to stay in bed until it gets all better. But just staying in bed and like avoiding life doesn't do that.
Yeah.
So can you speak to that piece a little
Yeah.
bit, and how people can sort of use these time off, whatever that means, like effectively?
Yeah. I think that that's often, right, the problem is that like the framing, like you're expecting that, oh, this is going to make me feel better. No, like I wish like things work like that. This is a really hard time. You might get some relief at moments, but it's about when we're in a crisis and we cannot change reality. It is about getting through these hard moments without making it worse, and making it more tolerable. So I think when you think in that type of lens, you also get less angry and less resentful, because I mean, maybe because not, you suffer less, I would say. Just think about it. Like, if you're not going to necessarily, you can make it worse by staying in bed all day. It's one day's fine, but if let's say you do it for a week, you're going to feel worse. And the point of going through a crisis, what is our goal? Get through this without making it worse. So, and making it more tolerable, which means, so whatever that is for you. So I think that's something to keep in mind. Like, is this going to make things worse in the long run if I avoid things for a week? No, you'll end up with more anxiety and more depression and more shame and more guilt, probably. So I think that's something to think about. And I think when you think in terms of that, like, oh, I'm not meant to be like, it's not meant that, oh, this is going to make me all better. Going to work means now everything is okay. No, but you can have, but when you think about it, that I can have moments in my day where I am okay. And when you're able to think about it like that, then you're able to tolerate every day better. You're thinking about, okay, I can have my 5 minutes of sitting with my chocolate. Again, our problem. So when you think of life like that, like, I can have moments where I will be okay for a minute. Then when you think about this whole crisis, it can feel like maybe I can make it. It just makes it more tolerable. Like, so I think that's something that we want to ask ourselves. So yeah, like, work is a great distraction. And yes, when you come home, it's okay to cry. And then, but do we want to cry for 5 hours? That's probably going to make it worse. So let yourself have your emotions for, whether that means an hour. But then if you know that you're going to watch a certain show that's going to elicit, sometimes people want it. Like, they want to feel those feelings. And like, I remember This Is Us for some reason. Like, it's a show, you cry and cry. And it's like, what? My husband would always walks in like, why are you watching this if you're crying? I'm like, I don't know. I just love it. So, meaning sometimes crying feels good. But if you know it's just like making it worse, then that's a time where, okay, I cried, I had my emotions, but wait, it's 9 o'clock now at night. And if I keep just watching this, it's just gonna make things worse. Let me try to, I'm gonna take a shower, I'm gonna go have my tea, whatever it is that you do, I'm gonna watch something funny. So even within the hell, right, that person's going through it, how do we make it out? How do we make it without being swallowed by being burned? Like, that's what I would say. So but yeah, I think when people come with this goal of like, oh, it's so stupid, it's not going to help. What do you mean, like, self-soothe? Again, the goal is not to, like, that's not our goal. Our goal is, how can we make these moments a little bit more tolerable? Viktor Frankl, he talks about this, like, how do people survive, how do they survive the concentration camps? When he talks all about this, it's like, I'm not saying you have to make meaning, but, it's whatever is going to, some people by finding meaning this, they write about it, can help people. You don't have to do that. You have to ask yourself, like, what helps me? What's going to help me get through this time? Some people use their imagination, and that, that's okay. So people imagine themselves having this one day. Some people it doesn't work for, but you have to ask yourself, like, what works for me? And, I have like a whole list of different ideas, but there's so many things that everyone's different and everyone's experience is different. And I think that's something that also has to be said. One's experience is the same.
A thousand percent. I was actually just going to say that, as you were talking, I remember, like, for me, after my miscarriages, I had 6 miscarriages, and after my miscarriages, I felt like I needed the time to kind of like be in bed, and that was my like wallowing time. Like, I needed those moments during the day, but I also needed to like get up and like prepare dinner and like be there for my husband. And many of my losses happened when I like had school age kids already. And so like they needed me to be functional. And there was this like interesting like dichotomy where I was a functional human being. I was a wife, I was a mother for like certain periods of the day. And then I allowed myself those other times that I could crash. And that kind of like helped balance me out, where I knew that I would have the moments where I could be sad and I could like let myself just like let it all out. but then like I had to pull it together and I had to just be. And I think like gradually the moments of my being together increased and I needed less and less of the time being sad.
That is something what you describe is what we like grief. I'm not saying should look like, but that's what grieving, like when we're grieving, that's what it looks like. It's waves. It's moments where you allow yourself to cry and feel sad, and then also doing the things that you need to do. Like that is like ideally where we want to be. It's okay if you're not there, but what you described is exactly because we need that time to be alone, to feel sad in it. Otherwise, you will, there's this idea of inhibited grieving, where if you don't grieve, you spend your rest of your life grieving in an intense level. So it's so important. I think about myself as well. Like I remember after my DNC, like I needed that day to just be alone and like read up on people's experiences. Like everyone's different, right? Like, so that's what I'm saying. Everyone's grief is different. And then I needed a time where I wasn't showing up to as many events. And then I felt like, okay, now I'm back. Like, so I think everyone's grief is going to look different, but yeah, it's so much about that. Like really checking with what you need, which is really, and not being afraid. Sometimes people are like, don't want to ask support. I think like there was like, it says like less than 7 people, I believe, less than 7% of people will actually ask for support when they're going through this. That's like so low. And I remember having, I told friends that I was expecting, and then when I had a loss, like I had to tell them, and which is sometimes why people don't want to, right. But it was the type of thing they all knew. I couldn't hide it, so I had to say. And I remember it was so kind. I remember people that night sent dinner, and they sent me a gift, like a care package. It was just so thoughtful. And again, like I think it's okay to ask for help. It's okay, and just even thinking about like if you know a friend's going through something, don't be afraid to kind of just like send dinner. Like sometimes people are like, oh, is she gonna be embarrassed? Like I mean, everyone's different, but I can't imagine. One universal experience is that no one usually wants to feel alone in this. They don't. I think that makes it worse. So knowing that, wait, there are people that care about me can really help you get through these moments. So sometimes it is helpful to really share it with someone that, but that again depends on you. Like there's so much like people feel like there's a stigma if you share it. So again, you have to check in with yourself, but I think that allowing yourself to grieve and allowing, to ask for help is so important. You're not meant to go through this alone. You're not. Like it's beyond, they say infertility is like experiencing a loss of a loved one. It's the same thing that you go through. And no grief is too small. Like I know sometimes people invalidate their experiences of like, oh, but I have children already, or oh, it was so early. There's no grief is a loss, and we want to give ourselves space for that. Like there's no such thing as like don't invalidate your experience.
How do people know, I guess I hear a lot, like how do people know like what they're feeling is normal? Like it's like, we know that we're supposed to be sad, supposed to. I hate the word supposed to, but I like it's also the name of my organization, and yet I'm saying I hate the word supposed to. But how do you know like how sad you're supposed to be, or like, like when you like are not so interested in your regular activities, or you're having trouble relating to people or getting along with your spouse, or you just have anxiety that's like, just all the time you're feeling anxious, like what is normal
Okay.
in terms of these emotions that are around like infertility and loss, and what is abnormal, and then
Okay.
like what do you do about it?
So it's a very good question. First of all, I would want to say a few things. The first thing is your experience is normal. There's no such thing as normal versus not normal, because what you're experiencing makes sense based on your experiences, your history, and everything about who you are. Now, so let's just put that out there. Now, the other question is does it start getting in the way of your functioning, right? Like that, like to the point, then you might want to think about medication or maybe going to a therapist. You don't have to wait that long to go to a therapist, but meaning I think that's really the question of like, if you feel to the point, like, I mean, besides that, most people who are going through infertility are struggling with anxiety and depression. And it could be, you know, the research is not sure what came first, right? Like maybe it's the medications. So you definitely, there's a big correlation. So you're going to be feeling on some level anxiety and some depression. The question becomes is this getting in the way of so much that I cannot show up to work? I cannot get out of bed. I feel like I'm yelling at everyone. I'm pushing everyone away. And you're not liking what you're seeing, then I would say, okay, like you're not able to sleep. You're not able to eat. Like when it's really, really impairing your functioning, then I would say like, not that it's not normal, but this is where it's like, okay, like let's see what else we can do. Can we, maybe you need, you know, maybe you can go to a doctor, see a psychiatrist. Maybe you can go add more support. Are you in therapy? Are you in a support group? Like that's when I would start saying, and you don't have to wait that long. You can go, I think preventative is the best thing. Like if you know that you are really struggling this, what, it's okay to ask for help. It's okay to, you know, join a support group. But I think the point is when it becomes like clinical, like when it's really, really, you're not sleeping at night. We don't want that. That's again suffering. Like that, if you don't sleep, that's going to impact so many things. So I think, you know, that's what we're really looking for is it's like, how much is it impacting your functioning socially, you know, at work, at home, with family, with friends, in your daily functioning. Like that's where I would say that's where maybe you want added support.
And
that's very normal to need that as well, because it's so much, it's such a correlation.
1,000%. And I'm actually going to give a quick spoiler alert. Actually, our next conversation, which hopefully will be dropping very soon, our next conversation is actually with a reproductive psychiatrist who's talking about like when medication is necessary. And she actually spoke about a lot of these similar things. When you're not able to function anymore, when you're snapping at everyone, when you're not sleeping, when you're et cetera, et cetera. And I'll use myself as the perfect example. I don't know about perfect example, but I'll use myself as an example. When I after all of my losses and when I tried to get pregnant again, I was terribly, terribly anxious all the time. I mean, this is why we have, you know, a separate support group for people who are pregnant after loss. And my anxiety, I am not a person who is predisposed to generalized anxiety, you know, at the general outset, like that's not my general personality or disposition. But I was so anxious. I like had trouble sleeping. I had trouble just functioning. And I ended up actually seeing a psychiatrist and going on medicine because I was a mess. And that I always use that as an example. I felt a lot of shame about getting to that place where I needed medication. But the reality was, at the end of the day, the medication helped me to be able to just function more normally.
Yeah. I think, thanks so much for sharing that. I think that that is something that people often go through. Like, of course you're anxious. And knowing that, okay, like I don't have to be feeling this way. I don't have to necessarily be losing sleep and not being able to function, and knowing that, wait, like I could reach out. I could maybe speak to a psychiatrist. So I think, yeah, like that, it's so important that people know about that, because people don't sometimes know, like, oh, like you're saying I don't have to feel like this. So I think when it comes to that point where it's really like what you experience and so many people, then, you know, there's obviously the typical anxiety that someone's going to have when they're pregnant after a miscarriage, and then there's, which of course, right, checking yourself, wait, do I feel the baby kicking, and all, going to your appointment and like catastrophizing when they're doing the sonogram, like that's all. And then there's the point where you're losing sleep, you're restless all day, you can't concentrate, you have no appetite, you know. So then you might, you know, medication could really, really be helpful.
Absolutely. Um, okay, as we're kind of, you know, winding up here, I think like what I'd love for you to share a little bit more about is just this idea about how people people all the different pieces that people are going through and that this is stressful, just like the validating and the normalizing again, like that this is a stressful time. This is like a time that people should like know that already, like the preventative
Wow.
piece of it. and
Yeah.
and to preventatively like reach out for support, and like anything else we missed here that you want to share about
Yeah.
this experience, like please, like the floor is yours.
Okay. So I think, okay. There's definitely this, as we know, like it's considered a stressor. It is the ongoing of anticipation and of not knowing and going through this painful experience, however your situation looks is a stressor. There's no doubt. And it's, so I think knowing that what happens when we go through stressors in our lives. So sometimes they pass, right? Like some of these stressors pass, and maybe your situation will pass quicker. What if it's not? You need to think of yourself in terms of that. When we're going through a stressor, is how do we cope? How do we deal with stressors in our lives? That means we need to, when we have so much on our plate, we want to think about, okay, like I'm feeling really stressed out. Maybe I'm taking on too much. It's going again inside of yourself and asking, what is it now that maybe I need to take a break with? Or maybe this is not the thing that I should be doing just because I did this 5 months ago or even 2 weeks ago. Maybe I need to say no to this. Maybe I'm taking on too many projects at work. Like giving yourself the permission for this time to be a time where your bandwidth is slower and in a way, I mean smaller, and in a way also like it makes sense because you are going through, it's considered a crisis and a life stressor and grief as well. So, how does anyone go through these type of experiences with not thinking about, like, not giving yourself space and a break? Like I said before, those mini vacations or that distraction that you need, or the saying no, really, really giving yourself like extra care, which people think like, no, they should just like go on with life, make it like everything is the same, but everything is not the same. And again, it really does depend on where you are in your infertility journey and like what you're struggling with. And for everyone's different. If you're someone that maybe experienced one miscarriage, it might look very different than when you've experienced a few. Or if you've never, you can't conceive or can't even get pregnant, however. So again, it's really knowing, I think that when we validate our own experiences, that is the biggest gift we can do to ourselves. So often the suffering that happens because we invalidate ourselves. We invalidate our feelings. We invalidate our experience. We put demands like we shouldn't be feeling this way. I should be doing this. What a terrible. I think that if we just validate so much of our experience of it is okay, I'm allowed to feel this way. This is what I need. I'm not like that person. Like stop comparing yourself. Like fun, she maybe looks like she's able to do this. You are not meant to be her. That giving yourself validation can take the little bit of the suffering away. Again, you're going to feel pain. And I think that that's one thing that everyone can walk away with is validating ourselves, right? How do we validate other people? Sometimes it could be easier, right? It's this idea that I understand that what you're going through makes sense given your situation. So that we can put ourselves in other people's shoes, right? Your feelings make sense based on what you're going through, based on who you are, based on your experiences in life. Why can't we do that for ourselves? And I think that is so much of just a foundation of getting through this. And just thinking about, like I said before, like, how can I make today, this moment, a little bit more tolerable right now?
I love that.
It's,
I love it. I think it's deeply important for all of us to remember, like even beyond the experience of trying to build a family, like it's deeply important to remember that life has stressors, and the way that we're all going to be able to get through it is by just like taking it easy and self-soothing and doing things mindfully, and like giving ourselves these breaks, because like we can't do everything. It's impossible
yeah,
to do everything.
we always need to do these things in general, and especially when you're going through like something like this. They say that it's like infertility is you're constantly grieving being a parent, like, and that's in this moment, right? It might change, but, and I think that is so profound. It's like sometimes we forget that, like it's you're grieving your future or what you thought your life would be like, and of course it's going to have an impact on you. It's a natural desire to want to reproduce, right? And it's very big values of many families and of people's lives. So when you're not able to, of course your body's going to go into fight and flight. And there are things we can do in the moment to make the hell a little bit better. So like, I think that's something that if you can leave with anything, just that.
Amazing. Amazing. Aliza, thank you so much for sharing this very like deep and important wisdom for all of us, like universally in this, in this fertility realm, but also like just in general with any kind of life struggle. I mean, it is we all have challenges in our life, and I think we like your message of just trying to remember to tread gently and to be kind to
Yeah.
ourselves and to know that your experience is valid, I think is just, it's so deeply important. And I thank you so much. Where can people find you if they want to reach out for
Um,
more of your incredible wisdom?
um, they on here at Aliza Tropper on Instagram. They can email me. You could Google me there and find but anyway, through email, through phone, we'd be happy, to talk. And thank you so much, Aimee, for having me. And I hope that, people get something from this.
Absolutely. I know,
And I
I
really
know that,
appreciate it.
yeah, no, I know that they will, and we will have, this will be, this will be up, on both of our, handles, and then this will go up on our podcast probably in about a week or two, and we'll put all those links there. Okay, Aliza, thank you so much.
Thank you, Aimee, for all that you do for the community. Okay.
Bye, everybody.
Bye. Take care.